Now we'll talk for a few minutes about treatment. The cerebellum and the brain require two things to function properly: fuel and activation. Fuel comes in the form of glucose, so we want you to have a good diet. We want to check the glucose levels in your blood test. The other thing we check is your oxygen levels, because the brain needs glucose and oxygen in the form of fuel. It also needs activation. So after we're done determining which side of your brain needs more activation, we will activate parts of your brain based upon your tests. Now, one thing we may do is called unilateral or one-sided adjusting. So we'll be adjusting your body to stimulate your brain. It's part of what's called brain-based rehabilitation. Other therapies, we might use our vibration, but again, only on one side of the body. We also use gentle chiropractic adjustments using the arthrostim. We found out many years ago that chronic pain and fibromyalgia patients and chronic fatigue syndrome patients, they just can't handle the standard classic chiropractic adjustment that's very manual. That's where you hear the snapping and popping and crunching sounds. Sometimes we just have to use light finger pressure and just hold. And sometimes we can graduate to using the arthrostim. They need to be done very gently, but they also need to be effective. Another therapy we use for brain activation is the upper body ergometer. It's like a bicycle, but you sit at a desk and use your arms instead of your legs. Why would you use your arms? Well, because the arms fire to the brain more strongly than the legs do. So we have you on oxygen. A lot of these therapies are done while you're on oxygen, and you'll be pedaling a bicycle. Most patients love that experience. We also may do auditory stimulation in one ear to stimulate one certain part of your brain. We also can do auriculotherapy, which is like electrical acupuncture in one ear. Now, we use these points, and it's very low dose, so you barely feel it, but it is very strong stimulation to certain parts of your brain. Another therapy we might use is a warm caloric in the ear. See, inside the ear there's endolymph, which can sometimes become hard like jello. We put warm water in the ear and then it just rushes back out again. It gives that endolymph a chance to warm up and become more liquid. That'll especially help you with balance and dizziness disorders. We could also use olfactory stimulation in one nostril. That goes to the same side of the brain. We also may use different smells. Unpleasant smells would stimulate your right brain, where a pleasant smell would stimulate your left brain. So depending upon which side of the brain we want to stimulate, we could use different types of smells. We may use visual stimulation. Looking at large letters stimulates one side of the brain. We're looking at the small letters inside this large letter would stimulate the opposite side. Another thing we could do is have you look at familiar faces or unfamiliar faces, because familiar faces stimulate one side of the brain, where unfamiliar faces stimulate the other side of the brain. The first one's probably better.